I watched as my new boss, orthodontist, Dr. Storm, as he showed me and my new coworker Amanda how to apply ligatures to a patient's braces. Many of you have probably never heard of a ligature, but as soon as I show you all, you should be familiar with what it is, even if you've had braces or not. It's these, and then shows on my teeth model, the colored parts on people's braces. They come in all sorts of colors. Kids could get them in rainbow designs or just solid colors. It's all up to your imagination. I never really understood how in the world it was even possible to attach these little elastics onto the shiny metal parts on people's teeth. Even though I've had braces when I was younger, it was a whole bunch of mumbo jumbo, never really understanding how the dentist store assistant was doing what they were doing and how they even fit their big fingers in my little mouth with the little elastic ties. It looks so complicated, but at the same time, Dr. Storm made it look so easy. Dr. Storm took one look at me and said, "Here, now you give it a try." I was so taken back that I was put right on the spot 10 minutes into my training. I had no other option than to give it a go. I took the instrument out of my boss's hand, and the rest is history. I want to teach and educate you all on how to apply ligatures to braces. We are all so familiar with how braces look, but we never really understand what goes into it. And this is when I would show the video of an orthodontist changing ligatures on a patient's braces. So that's about a minute. You have to get comfortable and understand the fundamentals, and lastly, be able to actually tie the ligatures. So I'm going to start off with the name of the instruments, which is very important. The first instrument we have is a basic 23 Explorer, which is used in all parts of dentistry. In orthodontics, the 23 Explorer is used to take off the ligatures. This has a very small, tiny, sharp, pointy piece at the end, which makes it easy to get in between the brace and the little elastic or steel tie. The steel ligatures and the plastic ties here are used to hold on the actual wire onto the patient's braces. I will show you then the actual ligatures. And then the hemostat is used in all parts of medical actually, but we're using it to actually hold the little ligature, and that's how you actually apply it. So you use that to apply the actual ligature onto the brace. Very important pieces of orthodontics. So I'll teach you all how to use the actual instruments. So this is when I would show how to hold the actual 23 Explorer in your hand. You would hold it like a pencil. So I would show that and how to rotate it and how you'd get used to it. And then I would show how to hook the actual elastics and steel ties on, and then how to release. So I would then show how to do this on my teeth model. I would do this with the elastic ligatures. So I'd first do the elastic ligatures, and then next I would then show it with the steel tie ligature. So I'd show you how to do that and how to hold it, how to twist, hook, and then twist again. So I would show all of that. So in conclusion, you first have to get comfortable with the instruments that you're using and know the names, understand the fundamentals, and then be able to tie the elastic or steel ligature onto the braces. Let's flash back to my first day of training again. I had the dental instrument in my hand and began to diligently tie my first ligature on my patient's braces. To my surprise, I had gotten it on my first try. The little girl I was working on looked up and looked at me and told me that I was doing a great job for my first time. I had mixed emotions. I was still so nervous, but overall just so proud of myself that I had just done that, all by myself. It honestly lit a fire underneath me and made me want to keep going. I am thankful that the first day on my new job, I was pushed to learn a new skill of changing the ligatures on braces. Fast forward to a year later, I was now the head dental assistant. The first patient I ever worked on, she was the absolute best. She went on to tell me that she told her classmates about me and that I was the best dental assistant ever. I am grateful I wasn't given the option to back out and not give it a try. For anyone that knew me a few years ago, I was anxious before trying anything new. But not having the chance to overthink it before doing it made me realize there was nothing to be afraid of and that my biggest enemy was myself. This skill taught me that I could do anything I put my mind to, and I am beyond grateful for that.